Well, Dr. Jensen, thank you for joining Inside Canberra, and we're having our Food and Health Pathways Forum on the 16th of October, and in conjunction with Bayer, you've been conducting the report research for the forum and some findings of that report. There's a number of things that have come out of the report that are quite unique. Can you tell us a bit about those things? I understand there's been even different search trends on how people search for fruit and what times of year they do that.
Well, I'll put the report briefly in a little bit of a wider context. Australia has been unique amongst Western countries in terms of its remoteness, which means that throughout the history of this country, there's been a difficulty for people in rural and remote areas of the country to get access to medical professionals. One of the things that we suspect may be happening is that this is being supplemented by this a wider cultural trend towards self-care, whereby people are actively seeking out information about medical conditions, even in cases where they're under the supervision of a medical practitioner, in order to better take care of themselves, manage health conditions, as well as prevent health conditions. With respect to some of the trends that you're just mentioning, we found, for instance, that some of the, apparently the campaigns that the Australian government has been launching regarding the consumption of fruit and veg seem to be somewhat successful, as people have been, over the last 5 years, more interested in searching for that particular topic. And the evidence suggests that nonetheless, this is somewhat cyclical. Likewise, search interest in fitness and nutrition and other activities to take care of oneself, likewise, face a lot of seasonal rises and falls. So, for instance, when it comes to things like the consumption of vegetables, we see that really spikes around the Christmas holidays. And then declines substantially thereafter. Whereas fruit, really spikes right after the Christmas holidays, when a lot of our summer fruits are coming to supermarket shelves. At the same time, though, it's during that same window you find people are not really paying attention to things like fitness. And that really declines in that week when between Christmas and New Year's, when it seems a lot of people are really, taking a holiday from that. It's not that they aren't searching for health things online, because they're certainly looking for fruit, but they aren't so focused on things like fitness. Beyond that, though, we've seen some wider healthcare trends and interests when it comes to both chronic diseases as well as managing health aspects. So, for example, looking at various chronic conditions, we see that cancers are something that really a lot of people are continually searching for, and those numbers have crept upward steadily. However, in relation to that, it's somewhat remarkable that the number one killer of Australians, heart disease, it does not really seem to occupy much of the Australian public's attention, at least in terms of something which would motivate them to become more informed about that condition. And that has declined somewhat over time. Obesity has declined substantially over time, despite the fact that obesity is a cause of many other chronic health conditions.
But you've mentioned that some of your research has shown that people are taking a more proactive role with respect to the prevention and maintenance of health conditions, especially chronic conditions, by using the internet as a source and a tool.
We have seen some significant increases in various other things, particularly when it comes to trying to find healthier ways to eat. And so people have been really looking at varieties of ways in which they can prepare vegetables. And they've been looking more at specific qualities about fruits. And this is, one of the things that we found that's kind of interesting is that you see transition from, some of these fad topics like concerns about gluten, which went up substantially from about 2012 to 2015 and has somewhat declined ever since. But meanwhile, the specificity of terms by which people are looking to find out more about fruits and vegetables has been growing in that period of time, which suggests that there's increasing health literacy, at least in terms of certain areas. And those seem to coincide with particular public information agendas that the government has been trying to help people become more aware about the need to consume both fruit and veg as a way to prevent a lot of diseases down the road.
Well, Dr. Jensen, thank you for giving us a brief preview into the forum and the report, and we'll hear a lot more detail and an elaboration of the full report on October the 16th in Parliament House.
Well, thank you very much.